Welcome everyone. This is our 9th webinar. The webinar is on using Spidertech to have a positive effect on low back pain. We are here in our beautiful studio in Toronto, Ontario, Canada, and we're excited to get rolling. We'll start as usual with our mission statement. You notice that we have refined this a little bit. Our mission is to elevate client recovery by arming professionals with a streamlined kinesiology tape solution. Short, sweet, and simple. I think it is a great example of how we do business here in Toronto, Ontario. We make our tape start to finish in Canada. All of our materials are sourced from North America, and the reason for that is so we constantly can refine the process, we can improve our products, and we can make the tape as good as possible. So I think this change in mission statement is a reflection on our company as a whole. My experience and my background, I am a chiropractor. I've worked with low back pain at the highest levels of tennis, highest levels of golf, both on the court, on the course, and in the treatment area. I've dealt with it through manual therapy and exercise rehab. Being a chiropractor is something that I work with many times every day in and day out. And I also help people in a multidisciplinary clinic as well. So I think I'm very much equipped to share my experience and hopefully give some insight as to how I think about using the Spidertech tape for my patients. And I'll do my best to make this as clinically relevant as possible. If we take a quick look at our webinar goals, we're going to keep this very simple as usual. We're going to learn how to use Spidertech tape and specifically the low back pro cut to help with your low back patients in a wide variety and wide range of different ways that low back pain arises. And then we're also going to look at how we can apply the low back pro cut to in different ways to help your clients and patients. The reason why I choose the pro cut is simple. The list of things that you see here is true because our product is so unique and so well made, high quality. It is standardized, simplified. As a result of being machine cut, it is long lasting and reproducible because of the fact that we're not using scissors, we're not fraying the corners. And it comes out already made for you. It also saves time, and you can do it everywhere because it is ready to go right out of the package. So this is why I originally chose the Spidertech Pro Cuts, and it's why I do today as well. All right, if we dive into our content today. So I tried to boil down low back pain into a bunch of different groups. Low back pain clearly is a very big category. It's I'm sure, a very difficult thing to test from a research standpoint because there's so many ways that low back pain arises. But so how we're going to attack it today is we're going to look at chronic low back pain, and this is simply put is your patients that have a change in the way they use their core musculature, the way they use their spinal function. Things have changed to make it suboptimal, and they end up with a reoccurring injury that kind of keeps coming back over and over again. And we'll get into this a little further, but the reason why Spidertech is so good with this, and I found out when I had my chronic shoulder injury, is that the tape is on there all day, every day. I mean, that's the secret. They're in to see you in the clinic, but which is fantastic and needs to be done, but the tape bridges the gap, so there's constant attention on that area of the body, low back today. All day, every day, and so that's where we can kind of kick past that chronic cycle of back pain. The second way we'll look into it is through the improvement of muscle tone and stiffness. We will separate those two things, where tone being the musculature's resting tension. It's what you and I feel as therapists, and the stiffness will be more what your client expresses in terms of, oh, my back feels tight, my back is sore. So it's more of a client-based complaint versus a tone, which is where we see it. From a performance and recovery standpoint, We will look at how tape can affect both endurance from a performance in the moment standpoint, but also how what the tape does on the skin to allow recovery to speed up, to improve, so we can get back to our optimal state as quickly as possible. We'll look into spinal curvatures, which simply put would be a good example, a scoliosis patient, how we can address that with different methods of tape. And lastly, our proprioception, which to me, I think how I think of that patient is someone who's lost control of their low back. Commonly, you'll see their mid-back, their thoracic spine is very stiff and rigid. Their hips may be limited or stiff and rigid, and they don't have the range of motion that they require. And as a result, the low back is generally doing more work, which leads to pain as a result of extra wear and tear versus being locked up and stiff. So that's where I kind of see the proprioception loss, is when extra work happens, and then that ends up turning into commonly disc injuries or other injuries of kind of extra motion. Okay, if we dive in, our first research article that we will look at, this one is going to address our chronic low back pain patient. This one is very short and sweet. I think they did a fantastic job. And what they looked at was, we have our chronic low back pain patients. A hallmark sign of that is with our chronic low back pain patients, they lose the flexion relaxation ability. And so what we see is when the low back muscles, and they looked at the erectors in this standpoint, or in this study, when they should relax in a situation where we touch our toes. Normally when you touch your toes, you bend forward as far as you can, the erectors relax to allow you to go into full flexion. With the chronic patients, we see that doesn't happen. And so what we end up seeing is the muscles never relax, but they're not strong with the chronic patients. So with that being said, this study looked at, okay, we will use an EMG to see what the muscle tonicity of the erectors are without tape, and then we'll put tape on, and then we'll see what the tonicity of the muscles are afterwards. And so what they found, after we take a quick peek at, this is how they taped. So real simple, they just put a couple strips up the erectors and the spine, and then obviously they put the pads on the EMG beside that to get the overall activity. So what they found was instantly, and one of their criteria was you had to have the flexion relaxation issue that we didn't see relax. So everyone who made it into the study had the flexion relaxation issue. And what we saw was that almost 44% of the people in the study instantly had their erectors relax. And that was again through our EMG evaluation. So a pretty cool thing where half our people, we'd see that normalization right away. And then also from the subjective standpoint, we also saw that, we also saw that 33% of the people instantly reported that their back pain improved by at least 2 points on the VAS scale. And so at least we'll say 2 points was seen, but that could be greater. And I think although this is a moment in time, this is a snapshot, this is where the tape does fantastic, as I mentioned in the very beginning, where this is not going to come off. This is going to be on all day, every day. So even if you didn't fit into that 43% of the people who instantly relaxed, it is quite possible that relaxation will achieve over time. And also the fact that we did get that relaxation, I would estimate that if you took the tape off right away, you would then go back to your normal chronic pattern, because your patterns have changed with the chronic issues. And so the beauty of the tape is it's on there all day, every day to kind of like push through that nervous system change with the chronic issues. And so what they concluded was that kinesiology tape is promising as both immediate and short-term pain relief therapy when applied to chronic low back pain patients. It rapidly reduces abnormal paraspinal EMG activity and may therefore be effectively used to complement a physical rehabilitation program. And again, that is very well said. We see our product as the adjunct therapy. You do everything you currently do, and then you decide to add tape in. And so because of that, the tape really is in a category all its own. Your choice is to either help your patients with tape and they go home with that, or don't help their patients with tape and they don't. So it's not as if you're taking the place of any of the manual therapy that you are currently doing. All right. So this next piece, and this is where we're gonna dive into our muscle tone and stiffness. This does blend in with what we saw with our chronic low back pain, because we just saw that the tone of the low back pain patients in the previous study improved by 43%. But this one will further give another example of how that kind of shows up in practice. So with this study, it was, again, very simple. They looked at the difference between what happens with the tonicity when you do a forward flexion or a toe touch. As mentioned, our muscle tone and stiffness, the tone is the way that the muscles kind of hold our posture, and it's what we feel and see as clinicians. I know personally, if I have someone lying prone on the table and their erectors are hard as a rock or activated in a position where they probably should be more relaxed, they're lying on their stomach and should be in kind of a comfortable position. If their erectors are hard as a rock, I know that if I get tape on there, they're going to come back next time I see them, and their back muscles are going to be improved. I see that all day, every day in practice. It's kind of a dead giveaway for me. Where the stiffness, again, is what they report as it feeling stiff, but they still might have the same range of motion. After a hard workout, you might feel like your back muscles are very stiff, but you can still get into that same range of motion if you push through the feeling of stiffness. All right, in our study here, they used just a simple Y-shaped tape. I would submit that if we look at our low back ProCut, which covers more area, we probably will get even better results, just being the fact that it covers more surface area on the skin. But in this study, they just used the Y, and what they found was, of all the people in the study, that there was about an 18 centimeter improvement in ability to get down and touch those toes. And that 18 centimeter looks to be about 20% improvement versus not having tape. So touching the toes without tape versus touching the toes with tape, we're looking at about a 20% improvement in the ability to flex forward. They measured it in terms of range of motion, but what we can expect, that means that it's a 20% improvement in the ability for your muscles to relax to allow you to flex forward. There really should be no improvement in the ability for the muscle to elongate in that time period. So we're just looking at the ability for the tape to interact with the nervous system to convince these muscles to relax or normalize and get down into a toe touch position. And then in our conclusion as a result, the effect of kinesiology tape using a Y flexion pattern may improve the active range of motion in lower trunk flexion. Medical professionals may apply kinesiology tape to a patient during or after treatment and rehabilitation to support low back musculature, to encourage the tissue healing process, and to avoid limiting the enhancement of improved trunk flexion range of motion. Further research is required to validate, and we'll push past that. And kinesiology taping has shown promising in several select uses, and thus should be investigated further with regard to proper technique and efficacy for specific pathological conditions. They also, in this study, looked at side bending and extension, and they didn't show as impressive. And I think that is just purely because if we think of extension as an example, there really isn't the same tissue restriction with extension. The extension is going to be more limited by the spinal structures or the skeletal structures, not as much through the abdominals, for instance, that we would see with the same restriction with bending forward with our erectors, for instance. And so I think the fact that we didn't see the same improvement with both the extension and the lateral bending gives evidence that the tape had more an effect on the nervous system, having an effect on those erector muscles. All right. So if we we kind of conclude those two categories, and we look a little bit more into our performance and recovery type patients. With this study, this was looking more through our performance, and what they did was they used the back extension test, the Boring-Sorensen test, and they had them do a test with and without tape. In this study, they did one group with tape on just the erector, so one strip on either one of the erector muscles. They also did tape throughout the entire core musculature, essentially, both anterior and posterior. And then they tested the differences in addition to doing it without tape as well. So we had three groups, no tape, tape on the erectors, and tape through the entire core. And they took a look and saw what the time to failure was with the back extension test. And then here's a peek at just our back extension test here. This is what they used for their objective measure. If we go to the next slide, yeah, excellent right there. Commonly used, and obviously they used the goniometer there to be able to determine that the back wasn't moving and positioning during the testing. And what they found, short and sweet, was if you put tape on just the erectors, that we see about a 13-second improvement, in which ends up being a 19% improvement compared to no tape pre and post. And if you put tape on the entire core musculature, we saw a 43% improvement compared to no tape, or a 66% improvement compared to that to no tape. So both are very significant. I think what this shows us is that obviously with that back extension test that we are using our entire core. It is a very rigorous test. You're going to absolute failure. And so getting more coverage on the skin is going to be an advantageous thing. We saw that there was a significant improvement with just one strip alone. You highlight just the area where you think the most fatigue will come from. You're going to see that improvement. So as a clinician, you get to choose what your patients, your clients are going to have to do with their activity or with their sport. You know the level of fatigue that they're going to go through, and so you get to choose exactly what part of the body you tape, how much you tape for the maximal benefit. So being that this was just one moment in time or one test in time, and it's from the performance standpoint, they thought, or one explanation for the benefit in the endurance was that the kinesiology tape application improves muscle endurance through activation of gamma motor neurons backed by tactile stimulation of the skin. These mechanisms might have contributed to the muscular endurance increase noted in both the groups. So I believe that to be true. I believe that the tactile stimulation on the skin does a couple things. It helps to keep the muscles relaxed. It helps to keep that tone down. It also helps to keep the stiffness down so you don't feel the soreness. If you don't feel the soreness, you're not giving up faster with the back extension test because you don't feel the same level of pain. That makes sense. From a recovery standpoint, and also from a performance standpoint, I believe that the elasticity of the tape lifting up the skin, providing more space in between the dermis and epidermis for the normal fluids to flow, whether it's blood, lymph, or any kind of swelling inflammation. I think all of these things, having normal blood or having more area to flow in and out of the area that's being fatigued, also has a significant improvement in the recovery, how you feel when you wake up tomorrow, but also how you do in we'll say a 5-set tennis match where you're feeling the effects of everything that's happened during that match. And so I think these two mechanisms are both working in your favor. And then from the normal, what I mentioned with the fluid flow, there's many studies that will show this benefit as well, where we get that the elevation of skin, and it helps with the muscle breakdown, whether it's lactic acid or creatine kinase to kind of move out of the area that's being stressed or where the tissue breakdown is. to normalize the tissue tension, the tissue quality, and allow you to do your sport longer. And so those two things, I think, is how we can see those big improvements in recovery, also in performance. And a side note, we have a number of athletes in a endurance standpoint, whether it's cycling or tennis or so on, that they will always use tape through the night during their matches or between their stages in cycling, because they know they're going to wake up feeling better the next day. And then, so in their conclusion, in the present study, the endurance of the back extensor muscles significantly increased in the participants of both groups, in whom kinesiology tape was applied, the erector spinae alone, and also the total core musculature group, in whom kinesiology tape was applied to all trunk stabilizing muscles. And here we see our list of the muscles that was applied to. Comparison of the group showed that the increase was greater with the kinesiology tape was applied to all trunk stabilizing muscles than applied over the erectors. And again, we saw that 20% versus about a 65% improvement. Okay. So if we dig into our next patient population, this will be our spinal curvature, our scoliosis commonly seen patient. And so this is where we start to see that how we tape will have an impact on the outcomes. We see that with normal taping for an effect on muscle tension, for pain, for fluid, or lifting the skin to allow the normal fluid flow underneath the tape, we will apply with no tension on the tape. We're going to have them stretch the muscles as far as we can. We're going to apply with no tension. When they come back up to a normal standing posture, we'll see that the tape wrinkles in itself. We see that kind of an accordion pattern as a result of the elasticity in the tape pulling the skin off of the underlying tissue. When we apply, we also can tape to have a structural effect, which is where scoliosis could be a time where you would do that. That's where we can start to add in a little bit of tissue stretch or tape stretch to try to pull the patient into a specific pattern or posture that you choose. And so in this study, in Group A, they apply without tension. In Group B, they apply with tension to try to have an effect on the curve of the spine of their patients. And in this study, this is how they propose that kinesiology tape can have an effect on your patients. I think this is bang on. This is how I kind of also see how I think about it in practice, is that we have tape. Anytime someone has weakness or pain or proprioception issues, or you can expand that to maybe muscle firing issues or any kind of awareness of your body issues, I'm going to get tape on that area to help the brain get more information about what's happening under the tape. And those three categories have a beneficial effect on how the spine reacts, the positions, or the spinal deviation in this case, but also the ability to control your posture, which you don't have to pull yourself into a better posture to be able to achieve better posture. Just having normal awareness or improved awareness of your body, we're giving the brain the ability to be able to correct posture and get into positions that might make life easier, that kind of make you more efficient and effective at your activities. And so what they found here is, and we'll paraphrase this, being that they did have a very lengthy conclusion, is that for our scoliosis patients, that our taping without tension had a beneficial effect. Taping with tension, specifically taping to pull postures into place, as long as the scoliosis was not a structural issue or a change in the kind of the shape of the spine, that we can see even more improvement through pulling and applying some tension on the tape. And so they extrapolate that by using your clinical knowledge, you can achieve those benefits, and then that also can take the place or improve the normal therapeutic use, which would be kind of a brace for the back. The brace for the back comes with downside as well, where the tape is obviously a much more. The side effects are much less, and so we could even use both in any case to further pull into positions that you'd like. So in conclusion, treating the causes of spinal curvature disorders and not just from the symptoms, using functional and non-invasive methods such as kinesiology tape could be a more advantageous choice for patients. Thus, in light of this, kinesiology tape was a great influence on the body posture, suggesting that some early non-structured spine deviations could be treated by kinesiology tape application methods instead of classic orthopedic corsets. So I think this is where we start to benefit from adding the tape in as our global approach. We would do our tissue work on the tight areas, on the tight muscles that would affect a change in posture. We would do our mobilizations or manipulations on the spine that may be restricting you in certain positions. You do all your exercise therapy, and then the tape is the adjunct on there to further continue the approach you're taking to give them a reminder to kind of pull them into a specific posture that you want. So a great final piece to the puzzle, and they get to go home and go through their day all day, every day with this change in their posture. All right. So last but not least, we look at our proprioceptive patients, and I think this is kind of the combination of everything we looked at. There's many reasons why we would have a proprioceptive deficit. It could be anything from just tension above, below. It can be from an old injury where it's kind of turned into a chronic issue. I would say most of the chronic patients you see will have a proprioceptive issue, and so what we're trying to do with the tape in this case is get on those areas that are vulnerable, get on those areas that their patients don't have the same amount of control for, and feed the brain information and hope that their brain makes better choices as to where they are in space, the muscle firing patterns, and that they can control their bodies in a better way. So for this study, they looked at a number of things, but proprioception was a big piece of it as well. So there was a 2-week study of kinesiology tape treatment for looking at the benefit effect of pain, range of motion, and muscular endurance for non-specific low back pain patients. And then they used EMG as well as pain scales to determine the outcomes. I think what's significant in this study was they used people with back pain. I think that's where we're going to see those changes in how you recruit back muscles. If you use people with out back pain and proper function for this testing, you probably would see different patterns. And so that's why I chose this study, and I think that's why this is very applicable for your back pain patients. We see that this is what they did for the outcomes with the EMG. They strapped the participants in and had them extend the back up against the strap, and then we had 3 groups. We had no tape. We see here. We see the next study. We have a group that did what they called a sham tape, which was the two strips going across the back, as well as they had the tape going across up the erectors for the taping group. I will say that when you tape in this method, as they did for the sham taping, because they're only 2-inch strips there, you probably get away with it. You need to be aware of the way that the tape stretches. The tape would stretch in this case in a kind of a traction standpoint. So when they flex forward in the erector tape, for instance, that would bend with them. When they flex forward with this sham tape group, the tape would not give. It's going to have no stretch in this way, and so be aware that taping straight, kind of transverse or kind of across the back like that, there's going to be no give from the tape, and then that can lead to irritation on the skin because the skin is going to move underneath it. And we would expect that because they were just looking at trunk extension in this case, that's not going to have an issue. But if they were to flex forward as far as they can, the spot where the skin ends, or sorry, the tape ends and the skin begins, there's going to be a huge traction point there because the tape is not giving and the skin is. And so a lot of that range of motion in the skin is going to come from that very moment, that very place where the tape begins and ends. And what we saw in this study was the average pain score for these participants was 7.5. And again, this breaks in also the tape or the no tape, the sham tape, and the taping, the erector group. With our sham taping, we still saw a benefit. We dropped about 2 points on the VAS scale, and then with the erector group, with the normal taping, essentially, we got down to almost a 1, or just over a 1 out of 10 on the VAS scale. So significant improvement in tape or in pain by taping properly. We saw from the previous studies that if you were to tape even greater area, there's a chance that you would see even a better pain reduction. And if we kind of go back to our low back pro cut, which also has a wider base, and it goes up across the TL fascia up into the lats, I think you would expect a greater improvement in pain using the low back pro cut versus just the strips up the erector. All right, so in this study, they investigated using kinesiology tape on the low back patients, and the proprioceptive piece that they were looking at is they aimed to detect total lumbar angle pre and post application of the tape and its relation to develop lumbar dysfunction or low back pain with surface EMG. And they did this through the use of to determine muscular fatigue and its effect on developing low back pain pre and post application. So they wanted to see, as you get fatigued, does your low back positioning angle change? And what they did find was that the angle in the tape and the sham taping, it changed significantly compared to the group that only had that had tape on properly. And so what we ended up seeing is that we saw a more extension position through the low back in the group that had no tape or the tape in a sham position. And then what they theorized from that was the excessive lumbar lordosis was the cause of the low back pain. So the increased anterior pelvic tilt increases a greater flexion or greater flexion of the SI joints, and therefore a higher torque of the L5-S1 joint and discs. This possibly increases the shear force at the level and overloads the discs, thus increasing the risk of disc degeneration. And so that's where the proprioceptive awareness comes in, was if we had tape on there with our back pain patients, they maintained a more neutral spine or a more consistent spine position. They didn't throw themselves into a huge extension position, and thus they're in a position where we're going to see less shear on the discs and the joints of the low back. And then in conclusion, the results of this study objectively demonstrate that kinesiology tape have beneficial effects on pain, range of motion, and the trunk muscle endurance in people with chronic non-specific low back pain of mechanical etiology. Excellent. So that concludes our last subcategory of patients that we kind of show up with back pain in our clinic. Let's take a look at how we would apply tape, how we apply the low back pro cut to see these beneficial effects. So in this video, great. So in general, we're going to attempt to ensure that we don't ever run out of range of motion with our taping. And that's why we get our patients into a flex position. If we were to put tape on with them standing vertically in a kind of relaxed position, then if they were to touch their toes, the tape would not have enough less elasticity in it to meet the amount of flexion that the low back would have, and then at that point, either the skin or the tape would give, and neither one of those is a good option. So we're going to put them in a position where the muscle is stretched maximally, and then we're going to apply the tape on there with them in that stretched position, ensuring we don't ever run out of range of motion underneath the tape. So as you saw, we put the base on there, and then from here, we can apply the tape up the erectors with our number 2 strips. And it is a bit of a skill to get the tape on with 0 stretch. If we were to just kind of roll the tape on, you'll be surprised how much stretch goes on in the tape as a result of that. So do your best to make sure that you're getting it on there with the elasticity being in like a no stretch position. And then the last strips, the number 3 strips, they go up over top of the TL fascia, over top of the lats, and kind of aim towards the shoulder on that same side. And so you can see here we get great coverage over the back, all of the important structures being covered. And then as you retract back up, we get that nice accordion look, which comes from the elasticity in the tape, retracting back, lifting up the skin. And so we can extrapolate that we're going to get maximal nervous system feedback as a result of the tape kind of lifting up and providing that constant stimulation of our mechanoreceptors underneath the tape on the skin. And again, if you'll be surprised if you put the tape on with stretch, that how the different look you'll see with the amount of lift on the skin comparatively than if there's no stretch on that tape. We saw with our scoliosis patient that the scoliosis study that the exception to the rule that I just described would be as if you wanted to have an effect on the posture. That's where you could apply stretch to one side of the tape over the erectors or the other, and that would be an attempt to kind of pull down that side of the body and kind of correct or provide just some change in posture as a result of the tension on the tape. I will say though that is a good tool to have in your toolbox. 95% of your patients are going to benefit from having the tape on there in a no stretch position. And simply put, that providing stretch on the tape comes with consequence. Almost all the reactions that you see in a negative way with tape, in my experience, have come from too much stretch. Because that stretch on the tape is transferred to the skin, and so that's where we see that shear going on through the skin. And so if you apply with stretch in the muscle, no stretch in the tape, we can eliminate tons of shear in the skin, and then we eliminate tons of the injuries to the skin as a result of the tape being on there. So. Most, or if not all, the taping I do in the clinic is kind of the auto way, is without stretch, and as a result, I see virtually no reactions, no irritation from the tape. Also, an indication of the high quality adhesive that Spidertech uses. All right, so if we go back and revisit our subgroups of our low back patients, we took a look at our chronic low back pain patients. We looked at how tape affects muscle tone and stiffness, and reliably with tone and stiffness, you'll see in other studies that the tape has a greater impact on the tone, which is kind of how we see and feel the tension on the tissue. It still will have a significant impact on the stiffness, the reported feeling from our patients. But I would say that it's probably a 2-to-1 improvement, where we'll see a 40%, if not greater, with the stiffness through the EMG and then the patients report a 20% improvement. So that tends to be what I see in clinic. Also, what all the kind of the body of research will show. And then we saw how with our performance and recovery patients, how we can tape to have those improvements. And then lastly, our scoliosis patients, our spinal curvature patients, our patients that need to be provided some correction in addition to just a difference in muscle function. And then our proprioceptive improvement, which it kind of is a encapsulation of all the previously talked about conditions. And then if we take a peek at our webinar goals, we aim to learn how kinesiology tape can help low back pain. I think we covered that quite nicely. And then also we aim to figure out and learn how we can use the low back ProCut in an application standpoint to get to see those improvements. We saw that the simplicity of the low back ProCut, in addition to the amount of coverage that we got over top of the low back, is really the secret to it being so successful. And then we'll finish with the quality and the quality of both how the tape is made, but also the look of it is how we can use Spidertech to build our patient practices, to build our volume. We certainly have tape for every patient in terms of range of motion, posture, tension, swelling, and so on. We know that it's helpful during the rehabilitation process, both pre and post surgery, but also with just trying to get trying to highlight an area of weakness and help with our rehabilitation. It becomes our treatment between treatments because it also doesn't impact anything else we're doing, but it's on there 24 hours a day, 7 days a week in between our therapy. And then how it looks on your patients is something that other people notice. They ask your patients about what's happening, what's going on with that part of the body, and the quality of how it looks visually is a great indication of your level of therapy as a clinician. And then let's jump into our Q&A. Get in the chat. Ask any questions that you have, anything we need to be highlighted or revisited, or just any kind of any patients that come to mind that you want to know how you kind of conceptualize using the tape for that patient. I'll jump over now. All right. So yeah, let's start with a couple questions. So the first one. Thanks, Janine. We'll get to that in one moment here. So the first question that we'll tackle is: do you always use the low back ProCut versus strips or rolls? I think the answer is to that one is it depends on what the situation you're in. I think the low back is the highest quality piece. I think it is a very quick application to apply. So that'd be the one that I would kind of default to. But the strip, in terms of the speed or just the ease of carrying it, if you're applying on the golf course or the field or kind of off out of the clinic, is a nice thing to have. So that's where a lot of times I'll use a strip. A lot of times I'll use the ProCut in the office, and then if a patient wants to apply it themselves at home, that's when I'll have them buy the strips, and it just makes it way easier for them to apply for self-application, or to have their spouse put it on, and it's something that they've not used in the past. The strip is really easy. And then the rolls, certainly, like, you can cut to whatever length you want, so that does come with value. I don't use a lot of it just because for most of my patients, the ProCut is the perfect size and shape. But that's kind of how I would compartmentalize how I would use the 3 was the quality of the ProCut, the ease of use or like the speed of use of the eye strip, and then the fact that you can just use the roll to cut to whatever size you want for unique kind of applications. That would be kind of how I would use those 3 things. And then the other one was how do you tape for sciatica? I would employ, if the low back is the reason for the sciatica, if it's a disc issue, if it's an irritation of the sciatic nerve at the level of the spine, that's where I would generally tape using just the ProCut and kind of reap the benefits there. If you wanted to restrict flexion of the low back, if excessive flexion of the lumbar spine was a big part of the issue, then you could apply the low back ProCut or eye strip with with a little bit of tension. I'll commonly, if that's the case, I will use our postural ProCut, and instead of putting it in a I position across the mid back, I'll put it in an H position across the low back. The middle portion of the H would go along usually like the TL region, and then I would have either one of like the strips going up and down the erectors. The reason you put that in that position again is so the tape tractions with the body, so there is give in a traction standpoint. If you put it straight across the back like this, the tape again is going to traction around, not up to down, not in that right direction. So I will use that sometimes. I also find that the structural piece on the low back does help with like a hip hinge if you're trying to promote a hip hinge and get away from a low back flexion pattern. So there is benefit to that too. So those are things I would think of. But maybe the biggest thing is just figure out where the sciatica is coming from. If it's a piriformis tension, I would get some tape over top of that piriformis in addition to all of the things you would do to have an impact on the piriformis. But yeah, figure out where it's coming from, and then know your objective with the tape, whether it's just getting the back to normalize it with function or a structural way, and then tape accordingly. So the answer for that one is depends, but hopefully that gives you some ideas as to how I would think about it. And then let's get back to our skin irritation question, number 3 there. How do you avoid irritation at the ends of the tape? My patients seem to get rash and irritation. So one way to know if it is an allergy versus a rash from the tape is if it is a skin allergy to the adhesive, the whole area under the tape will get red and irritated. If that's the case, Spidertech does have a gentle line of adhesive on all their products, and so that's where I would use that. And that gentle is used for kids and older people with kind of fragile skin. A lot of people use it on their face for facial taping and so on. So it is a different adhesive. It is more, it is gentle. It is more kind of gel-like. So it does kind of move the skin a little better. And so if you have sensitive skin, I would jump to that. But I think the most important thing with avoiding the irritation as a result of the tension on the tape is you just can't have tension on the end of the tape. I mentioned it kind of briefly during during our talk, is that the spot you're going to get it is where the tape meets, the tape ends and the skin begins. There's just so much traction on that particular spot of the skin as the tape is retracting back on itself to pull down. That spot where the skin begins is getting just traction like crazy if you're putting tape, putting stretch on the end of on the end of your application. So I think it's a great rule to just tape without tension. You're going to get great results, and you're going to avoid all these rashes that you get. Like I just don't see that with my patients as a result of just making sure we're not putting traction on the tape. And then you can even ask them, like after you put the tape on and they stand up, if it feels like there's tension on the end, just take it off and redo it, because it's just not worth the chance of it irritating your patients, especially if you can avoid it altogether. Okay, what would you do for a patient with limited range of motion where you don't get very good rippling effect? So I'm trying to think of a couple of reasons why you wouldn't get that. If for instance, you're limited because you've injured your low back, or maybe the knee's a better example, because you get the tape on there and the knee can't move, it can't flex, and so you kind of don't get that range of motion. I think you just deal with what you kind of have on there. A lot of times you'll see that with our fan Pro Cut, because it is made for having an impact on fluid transfer, so bruising, swelling, inflammation, lymphatic flow. A lot of times you'll see range of motion limitations with these type of things, and I think you just get the tape on there and have it lift up, and because of the skin tension, you're not going to see that ripple. But I promise you that the lift on that area of the body is still significant enough to get the fluid to move out of the area and to show improvement. You don't get the ripple effect. Maybe I'll say it a different way. You get the ripple effect on areas that have a huge amount of range of motion. So you see it with the low back. You see it when you get tape over top of kind of the infraspinatus, when you get a bunch of abduction across the body, and then you kind of retract back of the shoulder. So two things where like there's a big range of motion. When it comes back, we see that ripple effect in a significant way. So if you're dealing with the part of the body that doesn't have that same range, don't get discouraged if you don't see the ripple. Just kind of get it on there with limited or no stretch, and you're still going to get that lift in the skin and those benefits, both in terms of stimulating the nervous system and from a fluid transfer standpoint, depending on what your goals are for that patient. But to kind of like melt those two, or blend those two questions together, is the less tension you see, the more ripple you get. That's where we're going to have our dramatic decrease in the chance of getting skin irritation. All right. If there's any more questions, sneak them in at last minute. But I will say thank you to everyone for showing up today. It was, I think, a great topic. Hopefully you leave with some thoughts and some patience as to who and how you can help. I think the understanding the principles as to what the tape can do for each one of these kind of subgroups of low back pain patients is really very empowering. I mean, it's one of those things where the more you learn about how the tape can have an impact on the body, the more you realize that the tape can kind of help everybody. The more you understand that, just the greater impact you can have with your patient population. So I think this is a great thing to do, not just for the low back, but every kind of portion of the body, because the reality is that there's many reasons why we see pain in the low back, the shoulder, the knee. And so kind of understanding the principles as to what the tape can do for each part of those body is pretty empowering. And I hope this was helpful today. Thank you, everybody. We will see you next month, and I look forward to that, and have a great day.